Hi there, Duncan here, physiotherapist and owner of Life is Movement, here with another exercise video demonstration. I make these videos for my patients at the clinic. However, if you're not a patient and you find any of this valuable, please feel free to use it as you see fit. Just make sure you do so safely. So, I wanted to offer a stretch, a hip stretch, and this is particularly valuable for people who have gluteal or hip issues. And we're going to stretch into external rotation of the hip, which is basically a slightly weird movement, if you can see, where you bring your knee out to the side and your foot inwards. So it's sort of like crossing your legs like this. This is my left hip, so this is just normal, and this is external rotation. And people, particularly with like a gluteal tendinopathy or some hip issues, or they can often become or even issues with the lower back, can become very tight into hip external rotation. So I wanted to offer a stretch to help with that. So all we're going to do is we're going to lie on our back. And to begin with, you're just going to do exactly as I just did. Cross the legs. I put my left ankle just above my right knee, and I'm letting that left knee just flop to the side and just letting gravity do its thing. So I'm stretching into external rotation here. Once this becomes too easy, you can intensify the stretch by bending that supporting leg. So now I'm bending my right leg, and I've got more of an intensive stretch here into external rotation on the left side. And to intensify it further, all you do is you grab that supporting leg and you can start bringing it towards the chest. Now, my external rotation is not too bad, but I'm starting to feel a bit of a stretch here. Now, with this, you can take your hands. I prefer to hold under that supporting leg. That's just what works for my anatomy. Some people prefer to hold over the top. As you can see, I'm grabbing on my shin. Either is completely fine, as long as you don't sort of rip your leg towards your body. All we're doing is a nice gentle cuddle. How about that? A nice gentle squeeze, but nothing too hard. A stretch should just be within pain tolerance. There's no benefit. You don't get any prizes for being super tough and causing yourself pain. Nice and gentle, hip, external rotation stretch. From there, what people like to do is to progress to slightly more active things like pigeon pose. As many of you might be familiar, hopefully you can see something like that. Whereas you can see my right leg now is in external rotation, and then you start leaning into it, pressing your body weight. I love this stretch. But make sure before you start doing those more dynamic stretches, this is a mistake people often make in rehab. They pick late stage exercises like various yoga poses because they found it on YouTube or Instagram or something, and they slot them in the place when they should be doing more gentle exercises. So start with that floor lying external rotation stretch before you move into the more intensive sort of yoga poses and things like that. That is the lying supine hip external rotation stretch. I hope you found it useful.